If you're a man over 30 and you're experienced sudden severe joint pain, often in the big toe, ankle, or knee, especially at night, or if you have been told you have high uric acid and are on medication like allopurinol, this video is for you. Maybe you've had a gout attack or you're worried about it happening again. Today, we're taking a deep dive into gout, what it is, why it happens, and how you can support your body with food, lifestyle, and importantly, herbal medicine. I'm Garreth Falls. I'm a consultant medical herbalist here at the Wild Sage. Gout is an inflammatory type of arthritis caused by having too much uric acid in the body. It's a condition called hyperurinemia. Uric acid forms sharp crystals in and around the joints, triggering your immune system to create intense inflammation and pain. So why men? Well, gout is much more common in men, especially those over 30 and in those with metabolic issues like being overweight, high blood pressure, high triglycerides, type 2 diabetes, or a fatty liver. And men who drink a lot of beer or spirits or have a family history of gout or kidney disease are at greater risk. Hormones also play a role. Estrogen helps women excrete uric acid more efficiently, so men tend to have an overproduction or under excretion of uric acid. High intake of purine-rich foods like organ meats, sardines, mackerels, and large amounts of red meat, as well as sugar and alcohol, will help trigger the attacks. It will reduce kidney function, and certain medicines can also play a part. They cause dehydration, insulin resistance, chronic stress, and poor sleep, which all increase inflammation and therefore increase your risk of gout. Now, the herbal medicine approach for gout isn't just about lowering uric acid. We also want to support the kidneys, the liver, and reduce the systemic inflammation happening in your body, as well as improving metabolic health. Herbs can manage acute conditions and they support the body between attacks, as well as addressing the underlying metabolic and cardiovascular health issues. Now, for acute flares, I would be using herbs such as devil claw, which is an anti-inflammatory, willow bark, which is a natural source of salicylates, kind of think what you would have used in aspirin, turmeric as an anti-inflammatory, which supports the liver, and then ginger, which improves circulation as a compress in and around the big toe. For uric acid elimination, I would tend to use herbs such as nettle leaf, which is a mild diuretic, dandelion leaf, celery seed, goldenrod, and burdock, which support the kidneys and elimination. Juniper can be really helpful in the short term, but isn't for everybody, especially if you have chronic kidney disease. And then metabolic health. We want to consider berberine herbs. So this is golden seal, berberis, vulgaris, or Mahonia aquifolium. Fenugreek, milk thistle, rosemary, and hawthorn all support blood sugar, liver, and cardiovascular health. When it comes to lifestyle, hydration is key. Aim to drink about 1.5 to 2 liters of water or herbal tea daily, and focus on eating the rainbow. Lots of vegetables, lots of color, lean proteins, healthy fats, and reduced sugar, alcohol, and large portions of red meat in your diet. Regular movement is to be encouraged. Stress management, quality sleep are the foundations to make this herbal medicine work for you. If you fancy taking some supplements, then vitamin C, magnesium, and the wonderful constituent, the flavonoids. So supplements called quercetin and bromelain can really help here. But do check with a practitioner before starting a supplement regime, especially if you have other health issues or take any medicine. The goal is not just to stop gout attacks, but to improve overall energy and protect your joints, your heart, your brain, and help you understand your own body better. Now, if you've ever had a first attack of gout, if it's been red and big toe, hot or swollen, then do get it properly diagnosed. If you have a fever or feel very unwell, you have signs of an infection. Severe chest pain, shortness of breath, or neurological symptoms, and they're emergencies. Seek urgent care. You want to ensure that you're being seen to appropriately, and consult a healthcare professional if you're in doubt. Final thoughts. Gout isn't just about rich food. It's about your metabolism, your kidneys, and the inflammation in your system that all needs to be given attention here. Herbal medicine can support you in managing flares, improving uric acid elimination, and addressing deeper metabolic health. So don't ignore it. Use it as a wake-up call to take better care of your joints, your heart, and your well-being. If you'd like personalized support, then please contact me through wildsage@proton.me, or you can go to the website www.thewildsage.co.uk. I also offer a supplement called Get Out, designed specifically with gout in mind. For lab tests, diet advice, or long-term goals, do get in touch and I'd be happy to help. Take care. See you next time.